All right, so let's talk about a new tool in our toolbox. And actually, we're talking about spinal decompression. Spinal decompression has been around since well past the 80s. It's really come into a lot of popularity lately because a lot of clinics and other facilities have found out about the spinal decompression. Best way of explaining spinal decompression is that we take people that have got stenosis, bad discs, degenerative changes in the discs, degenerative changes in the spine. We place them on the spinal decompression, and the spinal decompression works like this. It is literally a series of belts and harnesses that helps to gently pull apart the disc space or the joint. But instead of keeping a sustained pull on it, it lets back and then pulls again, then lets back and then pulls again. The whole reason behind that is because it's hooked up to a computer and a servo motor that senses and knows that one of the reasons that sustained traction doesn't work is that when you sustain a pull on it, the muscles tighten up and everything just gloms on and doesn't want to let go. But with the decompression that we're using, it stretches, lets go, then stretches, then lets go. And the whole purpose of the stretching and letting go is to help open up the disc space so that those joints can rehydrate. We can get a little space in there. And when you get a little space in there, then that takes the pressure off the nerve, off the spinal cord, and off the soft tissue that's associated with it. Although spinal decompression has been around since the 80s, there are still a whole lot of people that don't know about it. My goal is to get more people exposed to that because it is a very effective, highly effective treatment. Nationwide, the success rate on spinal decompression is about 83 to 86%, which is really phenomenal considering that there's so many patients that do end up having spinal surgery. This is an alternative that can hopefully prevent the patient from having to do unnecessary drug medications and spinal surgery. The art that's associated with this is really not as glamorous as what you would think. It is a series. It's a belt, it's an upper belt and a lower belt. You're placed on a table, hooked up via cable to a motor on a computer, and then we start the cycle of compressing, decompressing, and easing back. All right. Well, let's talk a little bit about the actual procedure from the time that the patient comes in to the time that they actually start decompression. Patient comes in, we give, as always, we have a consultation. Then we review x-rays, we review MRIs, CT scans if they're available. We do an examination to make sure that the patient probably would benefit from decompression. Once we start on the decompression, that's not just the beginning and end of it. The decompression actually takes about 7 weeks, several times a week over that 7-week period. But in that period of time also, we include physical therapy modalities. We even use cold laser, which is FDA approved for decreasing pain and also promoting healing. We also include then physical therapy rehabilitation. Now, we're not in the bodybuilding business here, but we're in the body repair business, and as such, we add these adjunctive therapies with the spinal decompression to help the patient not only get better, but stay better. The procedures that we use get the patient better, but then the patient, through physical therapy rehabilitation exercises, then is able to sustain and maintain their level of correction. The neat part about the decompression is that patients have actually come in here in wheelchairs. Patients have come in scheduled for surgery. They're looking for that last resort, and somebody, usually another patient of ours, has told them about the decompression. They come in and they're in a miserable state. We talk to them, get them started in it. They're a little apprehensive, as anybody would be, but along about the second or third week, they're starting to notice some really significant changes. As I said before, the success rate is around 83 to 86%, and that 83 to 86% success rate translates into like a whole new person. I can't tell you the number of patients that have gone through that and have thanked us profusely for doing that. Well, we're just doing what we like to do and what we've been trained to do and what works best for the patient. When the patient is excited about getting well, we're excited with them, right along with them. We want them to be better. We want them to be well. We've got quite a few years. We've been doing spinal decompression for almost 15 years. So we have a lot of experience, and our staff is highly trained in taking care of folks and getting them through the process. If you're thinking about having spinal decompression, if you're in pain now, call us. We'll get you in right away. If you're concerned about finances, the girls will sit down with you and give you all the options and all the available resources that we have that will cover your treatment here. Now, for those of you that are insured, the insurance companies are not yet covering the spinal decompression. So that's why we've gone to great lengths to secure discounts, and we also have a company that will finance without interest your whole treatment program. So I really don't think there's any reason for you to sit at home and continue to be in pain. Give us a call. We'll get you set up, come in, have a consultation, and until you say go, we don't do anything. And I think that I don't think that you'll be sorry. I think you'll be well pleased with the outcome. So give us a call.